actually, Pradhan.
Good morning. Today I'll be presenting the visual profile of children with special needs who visited an early intervention and rehabilitation center. I have no financial interest. So an estimated 1.3 billion people in the world, they experience some significant disability, and in India this number crosses 2.68 crores, with the highest percentage of patients falling in the age group of 10 to 19 years. So in order to empower these patients and to have an early intervention as early as possible between the age group of 0 to 6 years, the government of India has come up with the concept of early intervention and rehabilitation center. So these has all these multiple different departments which cater to the needs of these children. So the one that I'm talking about started in July 2023 under the Topiwala National Medical College in Mumbai. We have seen over 1,500 patients till date, and in ophthalmology department there were around 420 patients. So the methodology included history-taking vision evaluation, cycloplegic refraction, anterior-posterior segment evaluation, and cognitive vision assessment. These are what we use to assess the vision in special children. A little about cognitive vision evaluation. It is essentially how the brain perceives the vision, which has a lot of components including color vision, contrast sensitivity, stereopsis, directionality, Saccard's pursuits, etc., etc. So the results of the first 400 patients included showed us that 2/3 were males, and as we know, it is already targeting 0 to 6 years of age, but we had a significant set of patients coming in the age group of 7 to 10 years. Majority were referred to us by other departments, and around 80 patients were referred to us by their school teachers. 40% patient had global developmental delay, with cerebral palsy being the most common cause, along with some behavioral abnormalities like autism and ADHD. Ocular ailments were seen in 90% patients, with refractive error being the most common problem, followed by strabismus. And amongst the refractive error, astigmatism was the highest CADR, and strabismus was of variable angle, with exotropia being more common than esotropia. The management included spectacles, vision therapies, low vision aids, and only 25 patients underwent squint correction surgery. So coming to the discussion, cerebral visual impairment, it covers a wide range of problem, which includes visual perceptual impairments resulting from dysfunction or injury to the retrogenicular pathway. This is the single most common cause of vision impairment in young children, and the most common cause of CVI is hypoxic ischemic injury, which because of which it's very important to ask for perinatal history, perinatal insult, history of neonatal seizures or seizures in the first 6 months of life. 61% of the patients who visited our clinic had a history of perinatal insult. Now coming to autism and vision impairment, they have a vicious role against each other. We already know that vision impairment, patients who have severe vision impairment, many of them develop aggressive autistic-like traits. But in the recent years, we have seen that patients with autism have also been found to have some amount of vision impairment. So if we treat those, their behavior has been shown to improve the moment their ocular ailments are addressed. So 53% of autistic patients who attended our Ophthal OPD were found to have refractive error. So to conclude, I want to emphasize on the fact that it is very important to identify the systemic ailment as early as possible. And as an ophthalmologist, we have to try glasses first. And we have to give basic vision stimulation exercises which will help the babies in the long run. It is very imperative to know that there are such dedicated institutions available across the country which have this multidisciplinary approach, and a regular long-term follow-up will help all of them. Thank you.
Yeah. Thank you, Dr. Priyarthi. Nice concept.
Yes, ma'am.
Okay. Thank you.
Thank you.